Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your familiar and friendly endocrinologist, and you're watching Dr. KK Med Talks, Mondays with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 749th 749वां एपिसोड है. Let's have the headlines for today. पिछले कोविड से तो हम उभरे नहीं हैं. We've not actually still got rid of COVID. But now a study says that a new COVID-like virus, COVID जैसा virus, which is found in bats, चमगादड़ों में है ये, this can infect humans and unfortunately it can resist vaccines. So what this means is कि vaccination तो करवाएं सही, but keep on following social distancing and basic personal hygiene. Another study has showed that obesity, और हम बार-बार obesity की बात करते हैं KK Med Talks पे, obesity costs India rupees 2.8 lakh crore. I honestly don't even know how many numbers there are in this, but 2.8 lakh crore rupees every year, and this is more than 1% of our GDP. तो अगर हम सब लोग इकट्ठा मिलके अपना वेट कम कर लें, we can add 1% to our GDP, to our gross domestic product. COVID is bad, but if you have COVID and swine flu together, that is even worse. And this combo, H1N1 COVID combination, has been seen in Kerala now, and 3 cases have been reported so far. The good thing is that the country is moving towards self-sufficiency, Atmanirbharta ki taraf, and a made-in-India heart is to be priced at 8 times, 1/8 of the current cost of imported versions. And another disease, hand foot mouth disease, जो बच्चों में काफी common होती है, इसका epidemic आ गया है in Maharashtra. So hand foot mouth disease is becoming more and more common in Maharashtra these days. With all this health related news, let's go to our topic for today. अब sports और medicine का आपस में क्या लेना देना है? What is it that sports and medicine have in common? Let's find out. And for this, we have the best dressed guest we've ever had on our show, and I'd like to introduce Dr. Sabir Singh. Warm welcome, Dr. Sabir Singh Dagar.
Thank you so much, sir. Thanks a lot for inviting me to your show, sir. I heard a lot about your talks.
It's great having you, Dr. Sabir. And more than 15 years of experience he brings to the field. He's a sports medicine consultant at Med Park Hospital in Mohali. He has served in the rehabilitation team of the BCCI, that is the Cricket Board of India. He is a team physician and exercise physiologist for the Indian national hockey team in the past. He has been tournament medical director of the Premier Hockey League. And presently, he is the team physician of the Punjab Cricket Association Senior Ranji Men's Trophy. So warm welcome, Dr. Sabir.
Thank you.
Dr. Sahab, बहुत सारे लोग logged in हैं. So people from all walks of life greeting you. Dr. Sanjeev Puri, आप ही के state से, from Punjab, from Dasuwa in होशियारपुर. ललित कथुरिया साहब जो सोनीपत से हैं, ये भी आप ही के स्टेट के हैं. ये आपको नमस्कार कर रहे हैं. और ललित साहब कह रहे हैं बड़ी अंडी टी शर्ट पहन रखी है.
Thank you, sir. Thank you so much.
If I were to paraphrase right now, I am very sure that Dr. Sanjeev Puri कह रहे होंगे बहुत कैंट टी शर्ट पाई हुई है. So, and also Dr. Ramesh Pal Singh Pawar sir, senior pediatrician, और कह रहे हैं संजय काम पे लगा, उल्टी बातें मत कर. Dr. Pawar sir है, Vinny Joklegar ji is a nutritionist from Bangalore. So again, very closely involved in sports and fitness and health. Mamta Arya madam, Rajendra Jain ji, Arna Tyagi madam. Swapna Jain ji is from Vellore in Tamil Nadu. She is an advocate for patients' health, for the patient's voice as well. And we have other sports consultants joining us today. Dr. Kiran Kulkarni, a very famous name in your specialty. So welcome. Thank you for sparing time for us. And also Muhammad Arshad Sahab, Arshad Deen Sahab, sending you a salam.
Thank you, sir. Same to you.
Dr. Sahab, you've chosen the topic sports and medicine. तो इसके बारे में तो बात करते हैं, but this year we are celebrating 75 years of independence in India and Pakistan. ये हमारे लिए special year है. What has happened to sports in the past 75 years in our country, in our subcontinent?
Oh, all right. So sports has always been there, our culture, and you see, if you go back, from the times of Dhyan Chand, when hockey was at the peak, we used to win, continuous Olympic gold medals in the hockey. Remember, winning a total of 8, about 6 continuously. So sporting has been there in a culture, but there were a lot of gaps, which were existing. So those gaps over the years have slowly started, filling up. Like the allied, sports sciences, they have come now. The biomechanics, the sports nutritionist, the specialist rehab team, they all have a role to play. Earlier, these support systems was not there, so they all have started, getting incorporated, and now everything is getting streamlined into a team. And from what we have seen in the last, Commonwealth Games, we have got a record tally. So I am sure that in the coming years to come, it's going to go up and up only.
So what we are hearing is Dr. Sadbir क्या कह रहे हैं कि sporting has always been in our culture. We have always enjoyed sports and games. But अब जो है कि एक support system आ गया है. That is the first thing we are hearing from him. And second is ये support system team की तरह काम करना शुरू कर गया है. It has begun to work like a well-oiled machinery, like a team. एंड जहां से डॉक्टर सतबीर सिंह हैं वहां पे कहा जाता है 1+1 इज इक्वल टू 11, 1+1 11 होता है. इज दिस व्हाट इज हैपनिंग इन स्पोर्ट्स, डॉक्टर सतबीर?
Not exactly, but yes, to a certain extent. And if you could further elaborate, what you're trying to ask me, sir.
1+1 11 is, let us say, like for example, JS कथुरिया साहब ने भी हमें ज्वाइन किया है, ललित कथुरिया साहब ने भी ज्वाइन किया है. So everybody is joining and everybody does contribute. In football, for example, or in hockey, if you have a brilliant individual player, he might be able to score one goal, he might be able to save one goal. But if everyone works like a team, and if you actually work like one single unit, मतलब 11 बदन हैं मगर एक दिमाग की तरह काम कर रहे हैं. And not only those 11 people on the field, the people outside the field, like Dr. Sabir Singh Dagar, like Dr. Kiran Kulkarni, like Vinny Joglekar ji, all the people who are helping, in a very humble manner. So जब ये इकट्ठा मिलके काम करते हैं, then it's not just one goal, you end up getting 11 goals. Does that actually happen in the playing field?
Definitely, definitely. That, that's what I said, in the beginning, that, the sports is going in a better direction because of this only. Now, everybody is working together as a team. Now, when we travel, we have a separate, sports nutritionist with us. We have a separate massager with us. We have a, rehab specialist. We have a sports medicine physician with us. So everybody is working together, and definitely, that gives you excellent results.
ये चीजें पहले भी थी. They are new for India, but are they new for the world as well?
So definitely, we were a little, far lagging behind. I remember the countries like Germany, Australia, Hungary. They were the pioneers of sports medicine, and they were definitely ahead of us. And yes, we were catching up.
So we've spoken of sports and we've seen कि पिछले 75 साल में क्या-क्या changes आए हैं, and Dr. Sadbir has been kind enough to sort of encapsulate this in one or two sentences कि ये changes आ रहे हैं. That was sports. Now let's talk about medicine. पिछले 75 साल में डॉक्टर सतबीर हमारी जो लाइफ एक्सपेक्टेंसी है वो डबल हो गई है. That is thanks to our colleagues in preventive medicine, in maternal and child health. They've done a great job. It is also thanks to our ASHA workers in the field. In ladies ने, ASHA workers ने बहुत मेहनत की है, and actually credit goes to them for improving our life expectancy. तो जब हम मेडिसिन की ताकत को देखते हैं और हम स्पोर्ट्स की ताकत को देखते हैं तो ये इकट्ठा बनता है स्पोर्ट्स मेडिसिन. That is our subject. So all of us are curious to know. Kedar Joshi ji bhi hain, Anamika Anu ji bhi hain, and Anshu Singh has logged in. Dr. Kiran Kulkarni says a comprehensive sports medicine team. But question aa raha hai sabse, ye sports medicine ka matlab kya hota hai? So what is it that you do? What is it that you do not do?
So sports medicine physician and the sports medicine as such, it encompasses all aspects of a life of an elite sports person, from his diet, his nutrition, his training methods and training methodology, his recovery, all kinds of medical illnesses which he goes through or is potential candidate to get it, how to prevent them, how to look after them in case he gets infected, how to increase the performance of the athlete, that's the exercise physiology. So all these things they together come under the purview of sports medicine, and we look after almost all of them and look after the sportsmen in totality. Now when you extrapolate it to the general population, Now, everyone is into exercise. Everyone is doing some form of exercise or the other. So that way, every individual is a sportsman. He might be not be playing for his country or for any national international team, but so sports medicine even covers all those people who are into exercise and who do regular exercises on a routine basis.
तो आपने अभी यूज किया वर्ड एलीट स्पोर्ट्स पर्सन एंड आई वाज गोइंग टू आस्क यू, तो स्पोर्ट्स मेडिसिन तो बहुत एलिटिस्ट स्पेशलिटी हुई फिर.
Yes, sir, because you can't afford to have a team like this for everyone. So those who are competing, we need to take extra precautions and special care of them, because a minor strain or a strain can also lead to somebody missing a very important event like Commonwealth or Olympics, and suddenly you end up losing a couple of medals. So life there is very, very strict and difficult. It's like a tapasya at that level, actually, sir.
And we saw it with the cricket team recently. One of our top cricketers getting hurt for no rhyme or reason, and then losing out a series for no rhyme or reason. Yeah.
Yes, sir. So that could have been prevented. That could have been prevented.
चंद्रकांत देशमुख जी भी आपको गुड इवनिंग कर रहे हैं, और वो पूछ रहे हैं, आपने ये तो कहा कि एलिटिस्ट है, या एलिटिस्ट नहीं, मैं कह रहा हूँ एलिटिस्ट, बट इट इज फॉर द एलिट स्पोर्ट्स पर्संस, बट फिर आपने ये कहा वी कैन एक्सट्रापोलेट ऑल दैट लर्निंग टू द जनरल पब्लिक. तो एज पार्ट ऑफ द जनरल पब्लिक यू आर राइट, धीरे धीरे हमारी भी जानकारी बढ़ रही है, आवर अवेयरनेस इज गोइंग अप एंड वी डू ट्राई टू एक्सरसाइज, ऑल ऑफ अस डू. सो लेट अस टेक अ फ्यू सिनेरियोज जो बहुत कॉमन हैं and see if you can give us advice. अब मैं जिम जाता हूँ, जिम में पहले क्या होता था करनाल में 15-20 साल पहले, एक पर्टिकुलर एथनिक ग्रुप के लड़के हुआ करते थे. The gyms used to reek of tobacco and alcohol, and it was just that particular group of people who would come. Now I see people from every walk of life. I see both men and women, boys and girls. Everybody is there in the gym. तो अब जिम में कुछ एक लड़के होते हैं जो मुझे लगता है उनको नशा चढ़ गया है जिम का. किसी को वेट लिफ्टिंग का नशा है, मुझे दिखता है कि वो he is troubling his body too much. That is what I feel as a neutral observer, not as a doctor, कि गड़बड़ हो रही है लड़के में. Then I see कि कई लड़कों में नशा होता है कि जो भी कोच सर ने कह दिया भी आप ये प्रोटीन खा लो, वो प्रोटीन खा लो, अंधाधुंध खा रहे हैं. एंड मुझे समझ नहीं आती, जब करनाल में प्रोटीन जो है, लेट अस से आई वांट टू बाय पनीर, that is not going to cost less than 400 rupees a kg, good quality. तो प्रोटीन का डिब्बा 250 रुपए किलो कोई कैसे बेच सकता है और कह सकता है जी इसमें 100% प्रोटीन है. विनी जोगलेकर जी will also be, I mean, I am very sure Vinny will say कि yes, there is nothing like 100% protein that you can sell commercially. तो इनके बारे में बताएं. Over exercise, too much of focus on the wrong eating, what are the common things you have seen and how can we prevent them?
Sir, definitely we'll start from the beginning. You said the awareness about exercise and health over the past few years has gone up, and you're right, हर age group का लड़का या लड़की आज जिम जाते हैं, they all are exercising. That's a very good thing. You're right, you see people age 60, 65, 70, they're going to the gym. And आपने देखा होगा एक मोहाली के ही हमारे यहाँ सरदार जी हैं, मिस्टर त्रिपाठी सिंह, उनकी कई वीडियोस वायरल होती हैं. He's about 76, 77. So now you look at his fitness, the way he's maintained himself. So definitely now people from each group, age group of exercise, they are exercising and doing it on a daily basis. So, but the problem, I tell you, where is the problem? When they go to the gym, there is nobody to guide them. The most of the trainers which are available in our gym are either not adequately qualified or are not qualified. And they do not know how to guide them. And now if you want to hire a qualified trainer, you'll have to pay a lot to him. And if you keep somebody who has probably exercised in the past and he's got good dole shole, usko laga liya, khada kar liya, so that makes your life easy. You don't have to pay him much and he's able to guide people with the basic exercises. But now this person does not know the difference between the various stages of development and exercise. Like initially you have to do a base conditioning, and then you have to go towards the performance enhancement. Now, performance enhancement is the last stage where you do high intensity interval training, plyometrics, and all those things. But what happens in the gym? This person, this trainer, the so-called trainer who's there, he wants to show his best knowledge. And from the day one, anybody who joins the gym, he wants to put him through the stage 4 training, which is to be done only after adequate base conditioning. So this is this basically violates the basic principles of training. So initially you have to have basic adjustment. So this is one problem. And right from the beginning, uh, second thing is diet fads. Okay, diet fads, we'll come to it later. You talked about the nutrition supplements and anabolic steroids, drugs. So yes, definitely, this is a huge industry, and it has got a gray market. And the actual authentic, good quality products are far and few in the market. The rest of them are duplicate products circulating around, and that's why they're available so cheap. And since there's a lot of margin available in them, they generally tend to push their candidates, the clients towards uh, going for these supplements, rather than advising them to go for a correct nutritional diet, which in itself is sufficient for a person who's exercising on a regular basis just for health and fitness, because you'll be exercising for 1 hour a day. For exercising, if you're exercising for 1 hour a day, you can easily make up with the natural diet. You don't need any supplements. It's only for elite sports persons, those who are doing heavyweight training, or those who are doing bodybuilding. Probably you need these added supplements in the form of protein to the extent of 1.5 to 1.7 gram per kg body weight, or 2 gram per kg body weight. That's on the higher side, but it's only for that percentage of people. Now I have been closely working with all the gyms in the region, and I know the people who are training there, and the clientele, and the extent of use of anabolic steroids in the gyms. Now that is another aspect. Now people do not have patience. The youngsters, they want to become fit. They want six pack. उनको डोले चाहिए 18 inch, 20 inch in a shortest possible time, and that's why resort to these anabolic steroids, and they're all available and everybody is using it. So we try to advise everybody that what are the potential side effects, and you should not take it. So this is one aspect of it, sir.
तो जो डॉक्टर सदबीर फ्लैग कर रहे हैं वो ये है कि एक तो आप जिम तो जरूर जाएं, ही इज एनकरेजिंग अस टू डू दैट, बट मेक श्योर दैट योर कोच इज ट्रेन्ड एंड इज क्वालिफाइड एंड स्टेप वाइज चलें. दूसरा जो कह रहे हैं कि डोंट कम अंडर पीयर प्रेशर. और आपकी बॉडी वैसे भी सुंदर है. आई मीन देयर इज अ डिफरेंस बिटवीन अ 100-meter रेस एंड अ मैराथन, एंड लाइफ तो मैराथन दौड़नी है ना हमने. So there's no harm in going slow, and we should avoid these unnecessary nutritional supplements and also the anabolic steroids. जो anabolic steroids actually बहुत endocrine diseases भी cause करते हैं. Even Dr.
Definitely.
Sabir, I also feel sad. OPD में लड़के आते हैं, they are the smartest, the best looking boys, but जब ताकत की बात करो तो बिल्कुल गोल है, जब टेस्ट वेस्ट कराओ तो बिल्कुल गोल है, and then they get in trouble after marriage.
Yes.
ललित कथुरिया साहब जो कि खुद एक फिटनेस फ्रीक हैं एंड focuses a lot on education and fitness both. He's from Sonipat. He says the general population is getting influenced by social media. The influencers should be banned. Okay, let's try, Lalit bhai. It should be allowed by only well qualified doctors and trainers. So Dr. Sabir, आपकी जो sports medicine की association है और जो डॉक्टर किरण कुलकर्णी भी हैं लॉग्ड इन, एंड आपके प्रेसिडेंट हैं डॉक्टर शर्मा, डॉक्टर वरुण शर्मा, he has been on the show also. What is your association doing? What is the name of the association? Can I join it? Can we all join it? What is it doing to address this issue raised by Kathuria sir?
Yes, sir. Sir, we have an association, Indian Association of Sports and Exercise Medicine. Recently, only we have opened it for the, other people, the fitness enthusiasts, and people from other branches. Initially, when we started exclusively for the sports medicine doctors. Now, recently we have opened it so that all of the people who are from different branches like sports nutrition, physiotherapy, and other people who are interested in joining and who are part of the same system, because finally we discuss it's a team. So all those people, we have opened it for them. And recently, a couple of months back, we conducted our first conference in Chennai. So now we want to take it to the state-wise, to separate states, and start a state association chapter there, and then go to the grassroots and start doing such activities wherein we can disseminate the true information related to exercise, medicine, how you should start, how to go about it, what to eat, what not to eat, regarding anabolic steroids and other things. So slowly we want to start taking such sessions in collaboration with people who are there like you, sir, who will definitely help us and support us.
That is nice. So which means Mr. Lalit and Madam Vinny can also join, and it's
definitely
SCM, right? If we go on the net, we can find it.
Yes, it's there.
Yeah. Will you read out slowly? Yeah. Can you spell it out slowly for us?
ISSEM.
Indian
SMV.
Society, yeah, Indian Society for Sports and Exercise Medicine. Vinny Joglekar ji adds another point, and along with Dr. N.S. Sharda sir and Satish Mukhija ji, who have joined us, Vinny Joglekar ji says that another issue is hydration in gyms. So, would you like to talk about water, electrolytes, and sports medicine, sir?
Okay. Now, hydration is a very important part of your training, but most of the people who are going and working out in air-conditioned gyms or gyms where are protected, that means they are not into outdoor trainings. They do not need that kind of hydration which they generally get onto. That can ultimately lead to hyponatremia. In a lot of cases, we have seen it happening. So when you are in a protected environment, even when you are in outside environment, initial 1 hour up to 60 minutes of see, it's actually a very complex thing, but I'll cover it point by point. In outdoor environment, also for initial 1 hour, you just need plain water to hydrate yourself. You do not need any electrolytes. Only when your session is going beyond that, then you start adding your electrolytes and energy drinks and fluids. So that has to be understood. I have seen even at the competitive level, the moment they enter the field, I'm talking about interstate competitions and that level. The moment the person comes onto the ground, he starts with his energy drink and 1 sip, 2 sip, half a bottle. And after 1 or 2 hours, I see they're vomiting on the ground. I've seen it happening with elite athletes. So we should not overdo it. The best indicator of hydration is the color of your urine. Now, all these things also depend upon the temperature at which you're working out. Now, if you are working out in summers in North India, okay, in open grounds, it's very hot. We normally don't advise them to exercise between morning 10 to evening 4. Sessions are to be taken either before that or after 4 p.m. in the evening. If at all you have to exercise and work out during, then you have to increase your water intake accordingly. So the color of the urine, it should be a golden straw colored and or whitish, silvery white. So that should be an indicator for you, because you can't otherwise keep a pH indicator everywhere. So that we tell them roughly. And otherwise, 250 ml to 300 ml of water every 20 minutes while you are exercising. That is good enough guideline for you to keep hydrated. And if your session is going beyond 60 minutes, then you can add electrolytes in the form of ORS or any other energy drink.
Right.
That you can keep on sipping in the volume of 20 to 30 ml every 20 minutes.
That makes sense, and an easy number to remember for all of us would be maybe 200 ml every 20 minutes or 300 ml every 30 minutes. That would be an easy way to remember, and electrolytes after 60 minutes. We have with us Dr. Muthu Krishnan, who is an endocrinologist. He would like to ask about protein intake. So let's structure his question in various ways. Is there a difference in the protein requirement for a 100-meter sprinter, for a marathoner, and maybe for someone in between, for someone who runs maybe 800 meters, or maybe who plays cricket or hockey for 1.5 hours?
Yes, sir. There is a difference. Now, the normal protein requirement we discuss is like 0.8 grams to 1 gram per kg body weight. Now, actually, it should be per kg of lean muscle mass. But anyway, so that we'll not discuss.
Ideal body weight, yeah.
But that we'll not discuss now. So, roughly taking it as in 1 gram. Now, if you are doing heavyweight training and if you're into strength sports like weightlifting, bodybuilding, then definitely the requirement goes up. Now, people who are into 100 meters or 200 meters or jumps, even they need a higher requirement. So for them, the requirement is 1.2 to 1.4 grams per kg body weight. Now, further going up into bodybuilding and weightlifting, sports like wrestling, power sports, there we are mentioning about 1.5 to 1.8 gram per kg body weight. And beyond that, it is not required, it's not recommended anyways.
So how about marathoners now, coming to Dr. Muthu Krishnan's specific question? He says elites do require higher amounts of protein, but what about amateurs who train for marathons, who run marathons in a non-competitive spirit? Do they need protein supplements, or will they be able to manage that 1.4, 1.2, 1.5 grams with the protein diet?
So between 1.2 to 1.4 per kg body weight, if they can manage with natural diet, fine. Otherwise, they can add supplements. Yes, there are some amino acids which will help you in recovery, like leucine. You have isoleucine, glutamine. So all these they'll help you in recovery. So you can add these. Definitely, there's no harm in this. But your total protein intake should be as natural as possible, and then later on you can add it. Now, marathon, if you're going to long distance running, it's a very extremely difficult sports. You have to have proper conditioning, before you go into it. And but you can keep your total intake to about 1.2 to 1.4 grams. Beyond that, it's not required in marathon. But yes, branch chain amino acids in liquid form, they definitely aid your recovery, prevent your muscle mass breakdown. So no harm in having that.
Okay, thanks. And if Dr. Jairman has any more questions, I'm sure he'll be happy to engage with us on this. And this is important also. It's good to give the right message to everyone. We have a friend from Afghanistan, from Kabul, Dr. Noor Aga Danish. Salam for you from Kabul as well, Dr. And Dr. Saab पूछ रहे हैं कि Dr. Danish पूछ रहे हैं कि what about patients with ankylosing spondylitis or any other form of spinal disease, spinal dysfunction? What would we encourage? What would be a strict no for them in terms of rehab and physiotherapy?
Sir, I have treated a very large number of people with ankylosing spondylosis, SLAB27 positivity, lots of them, and some of them in real severe pain. So what these people need is normal range of motion exercises, routine range of movements. They do not need special physiotherapy. They do not need any heavy training. Just very gentle exercises with the help of TheraBand, 2 kg weights, dumbbells, and stretches. And that's it. If they continue doing it, they prevent all kinds of damage, further damage. And to a large extent, we are able to even revert some fixed flexion deformity or extension of what has happened, which has already taken place. We are able to revert that also, and they lead a very good quality of life. So, range of motion exercises, gentle stretches, and very light strengthening exercises with TheraBands and very mild weights like dumbbells and all. That keeps them going, and there's no need to go beyond that. And that is safe, pretty safe.
So we should encourage, Dr. Noor, we should encourage people with ankylosing spondylitis to be physically active. One way of counseling them would be to say that God has given you your body. That is a gift from God, and it is your responsibility to take care of it. And you can quote from the Hadith as well to encourage them. And what the Prophet has said is that there is a treatment for every disease on earth except for old age. So old age तो अभी आई नहीं है. Ankylosing spondylitis वाले तो young होते हैं. So certainly there is a cure, and if that is through physiotherapy exercise, we should be following that. Dr. N.S. Sharda sir पूछ रहे India is a fat nation, is an obese nation. Unfortunately, true, Dr. Sab. But and a lot of metabolic diseases are there. So, Dr. Sabir, you have dealt with national teams so frequently. Is there any difference across India, across Southern Asia, in terms of being prone to diabetes, being prone to overweight, or is it all the same across the country?
So what I have seen is that thoughts there across the country, this diabetes and overweight, but it's more in the northern part of the country. Especially if you look at Punjab itself, the rates of obesity and the knee replacement are probably the highest in the country, in Punjab. So definitely our diet and lifestyle has got to do with it. We Indians or Asians, whatever you want to call us, we do not want to exercise. हम एक्सरसाइज करना अपने आप को कष्ट देना समझते हैं एक्चुअली, बट दोज हु स्टार्ट डूइंग इट रेगुलरली, देन दे स्टार्ट एंजॉयिंग इट, देन दे नो द हाउ मच pleasure it gives to you. So it is a combination of both. We do not want to exercise, and our diet and eating habits are such that so it's basically a cumulative thing. And other than definitely a genetic component which is there, we have that typical syndrome where we have centripetal obesity. So all these things contribute together. So northern part of the country is on the higher side.
From Ujjain, we have Dr. Pradeep Rawal who has joined us, and Nirmala Gupta ji bhi hain. Madam Rashmi एक question पूछ रही है. She says, I'm curious to know जो tennis players हैं. So when we are watching tennis on TV, we see that these elite players, they keep on drinking some beverage at frequent intervals. ये क्या होता है? What is it? And will it help me at home if I am an amateur player?
So they basically, these are energy drinks or these are high energy carbohydrate gels. So you must have seen they open up the packet, they pull it up and squish it inside. So these are high energy carbohydrate gels or the energy drinks they keep sipping. So they have 5 to 8% of carbohydrate along with sodium, potassium, and chloride. So basically, this is the combination along with some soda bicarb. So this combination definitely helps them because they have to play for 4 hours, 5 hours, 5.5 hours. So that is the extent of the matches which goes. So I'm not. I'm sure none of us, who are doing for recreational purposes, goes on to play for such a long time. So for them, a routine water which we discussed, 200 to 300 ml with a little ORS if you want to add after 1 hour of play, and that will be enough. And no need to go into those parameters for general enthusiast. Yeah, not required.
ललित साहब हरियाणा से हैं, वो पॉइंट रेज करते हैं कि जब एग्जाम के लिए जाते थे तो हमारी मम्मी हमें देती थी दही और चीनी. सो यू वुड गेट अ मिक्सचर ऑफ योगर्ट एंड शुगर बिफोर गोइंग फॉर योर एग्जाम्स बिकॉज दैट इज सपोज्ड टू मेक योर ब्रेन वर्क बेटर, मे बी द कार्बोहाइड्रेट एंड द प्रोटीन. तो ये कॉन्सेप्ट स्पोर्ट्स में भी लागू होता है क्या? हैव यू सीन दिस?
No, sir, I have not seen. I have not seen any of the sports teams or before the competitions or before the important matches doing this. So I don't know, Dr. Kulkarni, if you can contribute to it through a message. I have not seen it.
Let's wait for Dr. Kiran's comments. But would it be a good idea? Maybe like Karnal versus Sonipat. तो अगर Karnal district वाले and we say कि हमारी दही best है पूरी दुनिया में. So do you think
there is no harm, I think. It's not going to give any harm, So there's no harm in trying it if it gives us good results.
हमारे साथ logged in है Mr. Sabir Singh. And he is a coach in Karnal and he takes very good care of the fencing team here and he has been able to get Indian fencing right up to international level. Also what I see is that with the para games, the para fencing, वहाँ पे भी सत्यवीर जी उतना ही जोर लगाते हैं जितना normal fencing के लिए लगाते हैं. So maybe Mr. Satyavir, this would be a good low cost kind of an idea because in Karnal we are always trying to sort of get by without resources. तो दिस वुड बी अ गुड आइडिया एंड सतबीर सिंह जी एंड डॉक्टर किरण को भी रिक्वेस्ट करेंगे कि इस पे ज्यादा ध्यान दें और थोड़ी सी रिसर्च भी करके बताएं हमें. रश्मि जी पूछ रही हैं, सर, दो वी नो दिस इज नॉट अ ब्रांडेड और स्पॉन्सर्ड प्रोग्राम, वुड यू प्लीज सजेस्ट सम पर्टिकुलर ब्रांड्स प्लीज फॉर स्पोर्ट्स ड्रिंक्स?
For sports drinks, so we have Universal is there, then we have Muscle Tech, then we have GNC. These are good products. And then there's a company called as Clean Athlete. So these are some of the good brands which you can take, with mostly if you're buying it from an authenticated place and if these companies are there. So generally you get good products,
Dr. Kiran says, no, he's also not seen that. But Kiran, let's try. So I don't know too much of all the Indian languages, but Telugu I know. Ek pav perugu. That means 1 pav of curd. So let's try ek pav perugu for all our athletes now and see what happens. Let's just see what happens. Curd and sugar. Okay. Some of the brands, Madam Karnawat, that we use in endocrinology, that it's called Enerzel. So if you want to give a zero glucose drink, that would be Enerzel Zero. It will be sodium and potassium in a balanced ratio. If you want a low sugar kind of a thing, it will be Enerzel Blitz. And if you want high sugar, that will be Enerzel. So these are the brands that we use in endocrinology and we find them useful, especially for people living with diabetes and then when they want to go and exercise. That is a big challenge for them. So they have to be a bit more liberal with their fluid and carbohydrate intake, even during short-term exercise. Because we want to avoid hypo in them. और बहुत सारे क्वेश्चंस आ रहे हैं डॉक्टर सतबीर आपके लिए. डॉक्टर पूछ रहे हैं, सर, व्हाट इज टेनिस एल्बो? Okay. And how do I prevent it? How do I manage it?
So first thing I would like to tell him is that tennis elbow is much more common in general population than tennis players. And it is basically your extensor muscles of the forearm. They all come together and they have a common insertion at the outer side of your elbow. So that is a tendon which is getting inserted into the bone. Now, due to repeated, load on that due to repeated chronic movements, there are microavulsions happening at the junction of the bone tendon. And these microavulsions slowly lead to inflammation out there, and this inflammation then radiates along the tendons down to the muscles. And your wrist extension becomes extremely painful. Sometimes even lifting a glass of water becomes very difficult. So this is tennis elbow, and it's very common in general population, those who do not play sports.
And the prevention and the management?
Prevention is, sir, if you have forearm which is strong, you're not likely to get it. In general, though there's no mechanism, because sometimes if you're doing overactivity, so overdoing the forearm extensor muscle will also lead to tennis elbow, because your muscle is capable of lifting a certain amount of load. If you give a higher load, that will also going to cause a trauma at the point at the bone tendon junction, and you're likely to again injure it by causing a micro tear or further tear of the ERBS. But doing adequate amount of exercise to keep the forearm muscles strengthened, that will generally prevent, with mild stretches for the extensors and the flexor muscles, that will prevent, generally you won't have that.
Thanks for sharing this. Dr. Kiran also shares Gatorade sports drink, which has got 6% carb, and also Nutra supplements from Puna company, PUNA.
Okay.
सतीश जी पूछ रहे हैं, this question may not be logical, but सतीश जी हर एक question होता है, हर एक equally जायज है. मुश्किल सवाल Sabir is happy to take difficult questions. Are there okay? So नहीं, of course. So there was another question also. मैं दोनों इकट्ठे लेता हूँ. I'd forgot to take the previous one. देशमुख साहब ने पूछा था, what is the future of sports medicine as a profession in India? And Satish ji पूछ रहे हैं, any universities or institutes where one can learn sports massage?
Sports massage, not, I would not advocate any institute in India, but yes, there are good places, in Australia and Germany, where you can go for a good course in sports massage.
You would have to be a physiotherapist to do that? Matlab, what would be the basic entry?
Sir, basic entry, what I have seen in people who are working, it's just that you learn it and you go ahead. But yes, the basic entry level is everywhere generally is 12th with science background.
Okay.
Science that's the generally. Right. But I have seen in sports tournaments and various national international team people who are working who are not qualified, but they are an excellent in the massage and they are giving excellent work irrespective of the qualification.
And sports medicine and sports physiotherapy, what is the status and future?
Again, sir, we have seen it growing from 2005, I can say. I've seen it growing, a lot of changes in terms of infrastructure, in terms of new institutes which have come up with MD sports medicine courses. Like initially, when in our time we had only one place, NSNIS, which used to have 6 seats, PG diplomas. There was no MD medicine at that time. Now we have in various places. We have a lot of seats in Delhi, Safdarjung Sports Injury Center. We have in PGI Rohtak. We have in SRMC Chennai. In Northeast, we have another institute in Imphal. KGMC Lucknow has come up with institute, where another one is coming up in Bhopal. So definitely sports medicine is here and it's going to develop, and a lot of youngsters are now interested and they keep asking, where I can go and do my sports medicine specialization from. So hopefully things are going to go better and it's going to get better with time.
And Dr. Kiran also echoes what you're saying. So Dr. Kulkarni says you need to be a science graduate for that sports masseur job. Yeah. And also sports medicine is a very lucrative profession. So he encourages everyone to think about that. Vinny Joglekar ji, we were talking about yogurt. So she says lassi or buttermilk will also give extra probiotics. That is another plus point that we missed. And Dr. Kiran recommends Savita Medical College, Chennai. We can reach out to them.
He's also there. I got to mention that.
Yeah. Again, more questions coming up. There are actually so many questions. So Lalit sahab पूछते हैं, सर योर एक्सपीरियंस ऑन अल्फा जीपीसी. तो पहले तो डॉक्टर सतबीर आपको बताना पड़ेगा अल्फा जीपीसी होता क्या है. देन फॉस्फेटिडाइल सेरीन, क्रिएटिन, जिनसेंग, stinging nettle root, any other herbs and supplements. So what is the role? Is there any evidence? What do we do about all this?
So definitely there are now there are some supplements which are recognized by the Medical Commission of the IOC. They are recognized supplements, validated, and you can use them, and they have the scientific evidence. Like you have a creatine, like you have a glutamine, you have your proteins. So these things are legal and authorized, and they have their specific schedule and dosages. Caffeine. Caffeine is another supplement as an ergogenic aid. So these are available authorized ergogenic aids. Okay. Creatine, glutamine, your BCAAs, your caffeine. So these are authorized. But other than these, like if you talk about ashwagandha, ginseng, these have not been studied and these are not validated as, from the point of view of medical sciences. These are not validated to, take for specific things. But in sports, these supplements which I said, they are authorized and we use them with evidence.
तो डॉक्टर साहब दो क्वेश्चन, एक तो कैन यू ब्रेक डाउन इन हिंदी एंड इंग्लिश बोथ धीरे धीरे, अर्गोजेनिक एड का मतलब क्या होता है?
सर अर्गोजेनिक एड वो सब जो सप्लीमेंट्स हैं या वो न्यूट्रिएंट है जो आपकी परफॉर्मेंस को बढ़ा सकती है. देन योर नॉर्मल,
अर्गो मतलब एनर्जी हुआ ना,
energy will give you extra energy to go ahead or do better. So they will increase your performance than your normal performance without the help of those supplements. So that is the difference. So these are aids which will help you increase your performance, physical performance, whatever it be. So if you look at creatine, glutamine, or caffeine, these all have tested ones. They have had their specific recommendations after time trials and everything, that they are there. They boost your endurance, they boost your stamina, they boost your exercise time to capacity to exhaustion. So all these are known supplements. But yes, off the shelf there are a lot of them available. All such combinations are available in the market, but they have not been well researched and studied.
और दूसरा क्वेश्चन आ रहा है, ये भी ललित जी से आ रहा है कि वो कौन सी वेबसाइट है जहां पे मैं जाके देखूं कि which is the list of approved substances?
सर जाएंगे, I don't know what it, if you type WADA itself, sir, वो आ जाएगा आपका WADA, WADA.org. WADA.org पे आप जाएंगे and you just type list of banned substances. So on 1st October, 31st October, 30th October, somewhere in October, the WADA releases the list of banned substances for next subsequent year, which is valid, which comes into work from 1st of January next year. So the list for recent, this current year has just come out, and recently they have added tramadol also. Tramadol till now was not under the list of banned substances. It was under monitored substances. They were just studying the patterns of abuse. So a couple of days back only they have added tramadol. So they keep updating their list every year, and it comes out and you can see it on WADA.org, WADA.org.
And tramadol is something that we use a lot in pain, even in diabetic neuropathy, so we should be careful. और अगर आप एथलीट हैं, another thing that is coming to my mind, तो आप अपने डॉक्टर से इलाज करा रहे हैं डायबिटीज के लिए, ब्लड प्रेशर के लिए, किसी चीज के लिए भी, तो आप अपने स्पोर्ट्स मेडिसिन स्पेशलिस्ट से जरूर संपर्क करें. स्पीक विद योर स्पोर्ट्स मेडिसिन डॉक्टर एज वेल, कि कोई आपकी दवाई आपको कल को इनएलिजिबल तो नहीं कर देगी फॉर एनी टूर्नामेंट. सो यू शुड, योर स्पोर्ट्स मेडिसिन डॉक्टर शुड बी अवेयर ऑफ एवरीथिंग दैट यू आर डूइंग.
सर
Many more questions. Biswajit साहब पूछ रहे हैं, can I take so okay, that's for fatty liver, but Biswajit, we need to find the reason for fatty liver, and we cannot say fatty liver just like that. मतलब etiology ढूंढनी पड़ेगी. The SGOT-PT जो high है आपका, it can be because of hepatitis, it can be because of other things as well. So we should find the reason for that. Haldar साहब.
But anyway, what is the question? I would like to still hear, sir. What is the question?
Can we take ursodeoxycholic acid? And can we take saroglitazar for fatty liver disease?
Okay, I got it. He's going to that. But I'll tell you a couple of supplements which are there to prevent and help regenerate your liver. They're doing excellent. One of them is your milk thistle silymarin. Silymarin is doing excellent. And now in fatty liver, metatoxin also helps a lot. Now, most of the anabolic steroids are hepatotoxic. So to prevent the hepatotoxicity, all these anabolic steroid abusers or users, they all have silymarin and liver detox formula, which is a combination of a couple of multivitamins, metadoxin, silvimarin, and N-acetylcysteine. So this is the general standard formula which they take to prevent the damage to the liver or to regenerate their liver. So this is just off the.
So no good information for all of us. Dr. N.S. Sharda sir says that number one, sports should be made mandatory and compulsory in school. Your opinion on this, sir?
100%, sir, 100%.
I
Now,
think 100% India will agree with sir.
because
Right.
this not it increases. I mean, there are so many parameters which increase in a person. A boy or a girl. How you compete, how you accept defeat in life, the physical growth, the mental growth, as a team, how you work, so decision making
Social bonding.
capacity. All these things develop in a child, when you start playing sport, and which are very important for a multifaceted, development and personality. So definitely it should be compulsory.
And N.S. Sharda sir says that we were given sweet milk with sugar during school sports. So that is actually something from traditional practice. And I think Dr. Kiran, Dr. Sabir Singh, no harm in trying it out. Curd and sugar, and let's just see what happens. Let's begin talking about it, thinking about it with an open mind.
There's no harm in that. I don't see any harm if we take that and use it also. I don't think we see any harm in that.
More questions. And Sunil Sharma ji पूछते हैं, how much natural protein like milk, eggs, paneer per day is required for an average boy with average exercise? तो सुनील जी, इसका तो आंसर था 1 gram per kg per day, and yeah, 1 gram is enough. So Dr. Sadhvi, just now an average boy like Lalit or Sunil, should they be eating 10 eggs a day, 20 eggs a day? हमारे जिम में कई लोगों को शौक चढ़ता है.
Sir, that's what now again, the input which is given to them by the trainers in the gym, that is the basic cause. वो जाते ही उन्होंने बोला 20 अंडे खाने, 30 अंडे खाने. But by and large, they should be able to divide and plan their diet. Like say, most of the time, the vegetarians are the ones who are deficient in protein because of because vegetarian diets generally are found deficient. So, but you can tell them, what are the good sources. You can ask them to take, soybean nuggets. You can ask them to take protein. You can take, fat-free milk, tofu, and chana, rajma, all those things, a couple of nuts. So all these together, they, make up for your this type diet. But for a person who's going to the gym, he wants to eat 10 eggs. So let's say one egg is about, let's say 60, 70 grams. So it will be 6 grams protein. So if you take out the yellow, the egg white will give about 2.5 to 3 grams of protein. So if you take 10 eggs, 10 egg white, so that will give you about 10 into 3, about 25 to 30 grams of protein. So if somebody can take it, so it is a very safe and clean source of protein. There's no harm in that, but you have to ensure that your total in the day, let's say if you're 60 kg, if your body weight is 60 kg, a total requirement doesn't go beyond 100. It's not go beyond 100.
Right. So point well taken. And basically, there's no harm if anything extreme is suggested to you by anyone. There's no harm in taking a professional opinion from a nutritionist, from a sports medicine specialist, from an endocrinologist, metabolic doctor, जो भी हैं, जो भी आपके नजदीक हैं. And Dr. Sadbir, now if I want to search for a sports medicine doctor, मैं कहाँ जाऊँ? I live in XYZ state of India. How do I know कि sports medicine वाले doctor मेरे नजदीक कहाँ हैं? Will ISSCM help me?
Yes, definitely, sir. But then you'll have to reach ISSCM first. Yeah. But we have our website, sir. We have our website where we have a list of all the doctors which are active and who are working in the country with their phone numbers, mobile numbers, and their address of their clinic or hospital or whichever team which they're working with. So we have it on the website. So we have our website, sir. ISSCM की website है सर हमारी. It's there.
That will work. More questions coming up. Anshu Singh ji पूछ रही हैं कि sir, in the newspaper we have read now of people getting heart attack while exercising. There have been unfortunate incidents, and जब किसी celebrity के साथ होता है तो then the news gets magnified multifold. ये क्यों होता है, and how can we prevent such things from happening?
So the sudden deaths in sports and exercise, somebody's playing squash or somebody's doing, strenuous exercise in the gym. People have been dying in the past, no doubt. But what we have seen, the total number of deaths while exercising or while doing strenuous exercise, or while playing a game, and at all levels, at elite levels also, and at amateur, general population level also, at all levels, the numbers have significantly gone up post COVID. Now, this is one thing nobody can deny, but the problem is we don't want to talk about it. I feel strongly that COVID itself or the COVID vaccine, by and large, effects the same, because mechanism would be same. They are definitely to some extent responsible for some form of myocarditis or something, which has led to sudden increase in the number. Because what else can explain the sudden increase in number? Though I know it needs to be studied and researched further before coming to any conclusion or making a comment. But I feel that has got some role to play somewhere.
And that's right. Not only myocarditis, pericarditis can also occur after COVID. कोई भी inflammation हो सकती है कहीं पे. एंड एक्सट्रीम्स में जब जाएंगे तो गड़बड़ होने के चांस हैं. अब जो कॉम्पिटिटिव स्पोर्ट्स वाले हैं वो एक्सट्रीम करते हैं, लाइक डॉक्टर मुथुर कृष्णन है, ही इज एन एंडोक्रिनोलॉजिस्ट, ही डज द फुल मैराथन्स, ही रिसेंटली रन इन बॉस्टन. सो बट यू डू नीड मेडिकल सपोर्ट. वो 1+1 11 चाहिए. यू नीड डॉक्टर सतबीर सिंह एंड डॉक्टर किरण कुलकर्णी अलोंग विद यू if you want to run that marathon or you want to do anything extreme. Dr. Shashi Khare पूछ रहे हैं, is melatonin, that is a hormone, is it ergogenic?
No, sir, it's not. Melatonin is not ergogenic. Though it helps you indirectly, it can help you, like it improves your sleep quality and your recovery through that, enhances your recovery through that. So indirectly it may help you that way, but directly it is not classified as ergogenic.
And I wonder if Dr. Muthu Krishnan is still around. If he is, then Dr. Anand Sharda sir पूछ रहे हैं, Dr. Sadbir, for you as well, excess of games or sports, can it lead to hypoglycemia? And have you encountered that in practice?
A person who's non-diabetic, let him play for 3 hours, 4 hours, 5 hours, he will not go into hypoglycemia, because there are mechanisms of body as such that will keep on switching the source of fuel depending upon the duration and intensity of exercise, and you're not going to go into hypoglycemia and collapse if you're non-diabetic.
And also in diabetes, it will depend upon the medicine that is being taken. But type 1 diabetics are also able to play in competitive sports, and they're able to win their gold medals at the Olympics. So, but
exactly.
Yeah.
So there is no problem at all. All those who are, but when we know that this person is diabetic, okay, he's got type 1. So then we calculate their carbs, what time they're taking the insulin, and everything is calculated and scheduled. So there is no problem. The problem comes only when you do not know the status of a person.
And that point is well taken. And Dr. Sharda sir jo point raise kar rahe hain, that also reminds us that every sportsman, every sportswoman is a different individual, is unique. तो हर एक के लिए अलग चीज क्राफ्ट की जाएगी. मैं भी जब कई बार नेट पे देखता हूँ, when I see on social media people saying keto diet for everybody, intermittent fasting for everybody, 6 meal pattern for everybody, तो मैं मन ही मन में मुस्कुराता हूँ कि बाकी सब चीजें एवरीबॉडी के लिए सेम है क्या? Is everybody going to wear a blue t-shirt? Is everybody going to wear trousers? Or is everybody going to eat the same food, drink the same beverages at home? जब बाकी सब के लिए चीजें आप अलग अलग करते हो और आप वो भिन्नता को प्रमोट करते हो, यू प्रमोट डाइवर्सिटी, तो जब खाने की बात आती है, स्पोर्ट्स की बात आती है, देन हाउ कैन वी से कि everybody should run 100 meter, everybody should play kabaddi, everybody should take keto diet? तो ये चीजें मतलब अजीब सी लगती हैं. तो डॉक्टर किरण is also logged in with us. तो डॉक्टर किरण, डॉक्टर सतबीर, your opinion, individualization in sports medicine.
डॉक्टर किरण प्लीज.
वो भी कमेंट कर रहे हैं. He is with us and we are very happy to have Kiran with us actually today. सतबीर देख मुश्किल सवाल है, वो किरण जवाब देता है ना.
Every individual human body is different, and you must have seen every human body responds differently to nutrients. The way they also sometimes, you must have seen, respond differently to different medicines. So we must individualize it, according to the patient or the athlete, and definitely we should not give one size to all type of treatment. No.
आपके जो डॉक्टर हैं, सबसे पहले वो आपकी हिस्ट्री लेते हैं, फिर एग्जामिन करते हैं, फिर टेस्ट करवाते हैं. So this hierarchy, does it work in sports medicine as well, Dr. Sabir? Supposing, let's say I am gunning to be an international or national athlete or sports person, and I come to you. So what do you do? आप करते क्या हो मेरे साथ?
Sir, we in routine we do all your first there are various things. One is we have to look after your musculoskeletal system first. So musculoskeletal system, we do a fundamental movement screening and we check the status of all joints, tendon, ligaments, koi muscle short nahi hai, koi tight nahi hai. All that is part of MSK and fundamental movement screening. Based on that,
right.
Based on that, rehabilitation or a rehabilitation program to correct those things or to increase the strength of some structures. That is one. Now, second is we go for the body composition analysis and we see whether we need to increase the fat mass or increase the muscle mass or decrease the fat mass based upon your sports requirement. And accordingly, we change and advise the dieting patterns. So accordingly, we play with various variables, various components of diets and advise them. Third, we look after at the recovery methods. Post heavy training sessions, we look after their recovery sessions. So that includes all nutritional needs, your sauna, steam, baths, recovery, icing, nutritional shakes, and everything. And then we at times conduct their routine sessions of VO2 max calculations, basal heart rate calculations. So these things, give us the basic physiological parameters. Because at every level we have to see, like the VO2 max, a person who's playing at national or international level, his VO2 max would be like somewhere between 45 to 56 ml per kg per minute. So we measure all these parameters, and if we find something is lacking in somebody somewhere, then we increase and tell them to go for various generalized training methods. We discuss with the coach, and we tell them that this person needs this specific type of training. At times we measure their lactate levels in the blood, see the lactate threshold. Somebody is getting fatigued too early, so we give them a lactate threshold kind of training so that he doesn't get fatigued too early. So based upon those, we go for the intervention. Then let's say we also go for some blood profile. So like most of the women team, you'll find the hemoglobin low, and so we advise them go for a dietary intake of iron, or sometimes we give infusion of iron. So all these things we keep doing on routine assessments.
So what I see is कि पहले आप history लेते हैं, फिर examine भी करते हैं, investigate भी करते हैं और treat भी करते हैं. So the same hierarchy is followed. Message ये सबको देना चाहेंगे. We would like to give the message that, and like Dr. Kiran is also saying, Dr. Kulkarni says, we cannot standardize. We have to make it tailor-made for each person, and that will be based upon that person's needs and requirements.
Yes.
Dr. Homemaker Madam has also joined us. Madam is from Kolkata, and a very strong advocate for patient health, for self-care. तो ये जो पॉइंट हम डिस्कस कर रहे थे कि स्पोर्ट्स मेडिसिन भी एक बहुत कॉम्प्लेक्स फील्ड है, एंड इसमें डॉक्टर साहब आप साइकोलॉजी भी भूल गए. यू अपार्ट फ्रॉम ऑल द अदर थिंग्स दैट यू लर्न, आप एग्नी अंकल भी बनते हैं क्या?
सर, I'm so sorry, I forgot to take, दिमाग से निकल गया. Sports psychologist, is a very important part of the team, because the amount of pressure that is there at international level is so much. You need some counseling, you need somebody to speak to, somebody who can motivate you. That's very, very, very important. And most of the good teams, they have a psychologist with them, sports psychologist.
And it's part of your work as well.
Yes, it's part of our work as well. And we at our level, whatever knowledge we have. And one thing I'll tell you, most of the sports physicians are the ones who have been sportsmen themselves at some point of their life. You can look at Dr. Kulkarni, myself, anybody who's in the field. I used to play from a college, my university, army I used to play all sports with them. So we understand to a large extent, our mentality. We understand how you compete and what is a psych at that time. So we are able to communicate with them better, So it helps as a sports physician if you have been a sportsman yourself, some stage.
And that would be nice. So बहुत सारे लोग thank you भी कर रहे हैं आपको. And एक question आ रहा है. अच्छा, सतीश मुखीजा जी साहब ने भी सवाल पूछा है, योगा एंड स्पोर्ट्स मेडिसिन, इज देयर अ रोल?
Sir, yoga, we practice it in a, what do you say? Yes, it has a role. When we incorporate yoga in our practice, like I was with the Punjab cricket team for a long time and with BCCI for a long time. So for our cricketers, we had introduced, but we just wanted two things of yoga. We just wanted the concentration methods and relaxation methods. Only for these two things, we used to request them. They used to come and take sessions for them. Rest, flexibility, stretching, all that, the routine power yoga, all those things. That we used to take care of it ourselves, with our general strength training methods and our, other things. So we needed them for two things, for concentration and relaxation methods. We used to call them.
And that's good. And एक और point आ रहा है from the audience. This is from Seema ji, that sitting for more than 20 minutes is equal to smoking one cigarette in terms of cardiovascular risk. So, Dr. Sabir Singh, आप क्या करते हो अपनी OPD में? That is the question.
Sir, actually, my work is such, I'm involved with various people, so I keep moving around. इस room में, उस room में, उसको कुछ exercise कराई, इसको कुछ therapy लगाई, कुछ किया. So generally, I'm not sitting for a long time. But then, yes, every half an hour to 1 hour, if you have a sedentary lifestyle, you must get up, do some office stretches. You must take a break, do some exercises, some range of motion exercises, some stretches, and then sit down again. And sir, I'm very soon I'm going to make a video and circulate, and I'll request Dr. Kalra to please circulate it to especially all our doctors, and because they generally keep sitting and doing the work. So I'm on the process. I'm making a video for them.
That's a very good idea, and we can make it an all India and including Afghanistan, Pakistan, Nepal. We can make it a multinational thing just to see how doctors work in their OPD. So the theme should be, my office is my gym. How can you convert your office into a gym? You don't have to have all those dumbbells there, but आप अपने दफ्तर में, अपने व्यवसाय वाली जगह पे, wherever you are working, आप उसी जगह पे आप कैसे physically fit रह सकते हैं? Because you are spending 8 to 10 hours a day there.
Yes.
Lots of thanks coming in, and yoga is a way of life. Point well taken. So yoga is a way of life for all athletes as well, and for everyone. एक क्वेश्चन आ रहा है कथुरिया साहब से, डू यू हैव अ कीरोप्रैक्टर एंड फिजियोथेरेपिस्ट, अंतर होता है क्या? इट्स
Sir, this is a concept, the chiropractor and osteopath. This is a concept, which was prevalent in the European countries and then American countries. It is not there in our country. Basically, they are the ones which do some kind of soft tissue manipulations of the joints and the various things. Now, this thing has been taken up in the modern medicine by under the terms of manipulations and mobilizations of soft tissues. So this is done by physiotherapists themselves and sports medicine doctors who are trained in it. Like I am trained in it, I'm myself doing all these things. So we do not have, we do not need them now probably, but this concept has been there, it's been going on.
So it's part of sports medicine.
Yeah.
Dr. Kiran says sporting background is great to connect with the sportsman. And honestly, pehle maine pada squatting background. So it's sporting background. That's right, what Dr. Sabir is saying. But squatting is also not bad. So, Dr. Kho and Kabaddi, your opinion about these games from a health point of view?
Sir, excellent. From a health point of view, Kho and Kabaddi both are excellent games. And Kabaddi adds a lot of strength also. And in northern part of the country, they are there, and especially at village level and our rural level, these games are very popular, and that they keep these people fit. And I've seen all these people. Whenever I met these people, who come to me with some injuries and all, I've seen they're very fit. There's a game in Punjab called a circle kabaddi. You must have heard of it. So circle kabaddi players, they come very fit and very strong, So these games are definitely excellent, sir.
Kabaddi is a nice thing because वो balance करता है aerobic power को भी और resistance exercise को भी, दोनों चीजें. And from an autonomic point of view, it's a very good way of balancing parasympathetic and sympathetic. आपको तेज भी दौड़ना है, वापस आना है. That is sympathetic. In Ayurveda, we have Ayurvedic doctors with us. That would be like Vat, or it would be Rajsik. And at the same time, you need parasympathetic strength. आपको resilience दिखानी है. Kabaddi, kabaddi, kabaddi. You have to keep on saying it. That is parasympathetic. So you have to have a balance of everything. That is the beauty of this game. Dr. N.S. Sharda sir, Dr. Sadbir is a senior physician, तो इससे बढ़िया compliment आपको आज की डेट में नहीं मिल सकता. Dr. Sharda sir is tempted to restart playing again now, and he is thanking you for that.
That's great, sir.
मैं-
All the
सर
best,
ने
sir.
अपनी एमबीबीएस सर ने अपनी एमबीबीएस की हैदराबाद सिंध से, पाकिस्तान से, एंड ही हैज
Okay.
बीन इन अहमदाबाद फॉर सो लॉन्ग. इन द 1971 वॉर he donated blood for the Indian Army.
Oh,
मैं ये कहना चाह
great.
रहा हूँ, that is how senior sir is. हाँ. And sir is going to restart sports again. So that is one good thing. आज नवरात्रों का पहला दिन है, तो that is one good thing which Dr. Dagar has achieved today.
That's a please.
Okay, and it's already 8, और सीमा जी एक्चुअली हमें ये याद कर रहे थे कि 1 घंटा हो गया तो उठ जाओ. Otherwise, Sabir, it will be like you've taken 2 cigarettes today, which is not a good thing. सीमा जी पॉइंट आउट कर रही हैं, not only is your office your gym, your legs, your arms, your hands and feet, they are also the equipment of your gym, so you use them. Comments on this, Doctor?
Sir,
My limbs are my gym.
excellent. You don't need a gym. So a person who wants to exercise does not need a gym. Running, jogging, jumping, these are considered as mother of all exercises. You can do all kinds of strength training with the body parts. If you want to, I have seen a lot of people who do not have any equipment, who just do body weight exercises, or with the use of natural surface. And excellent it is. You do not need. If you want, you can exercise with the body parts and with the natural surface available. You do not need any equipment.
एंड ज्योतिका रैना जी भी आपको नमस्कार कर रही हैं सर, एंड रश्मि कर्नावट जी शेयर कर रही हैं दैट हर सन हैज डन स्पोर्ट्स मैनेजमेंट फ्रॉम ऑस्ट्रेलिया, सो बेस्ट विशेस टू कर्नावट साहब फॉर हिज करियर इन स्पोर्ट्स मैनेजमेंट. With this, Dr. Sabir, आपने इतना कुछ शेयर किया. We acknowledge your expertise and we thank you for your time as well. Pratik is with us backstage. Pratik, would you please show a certificate of appreciation for Dr. Sabir Singh?
Oh,
Thank you.
that's
Dr. Sahab,
wonderful.
आज का हमारा टॉपिक था स्पोर्ट्स मेडिसिन, एंड वी हैव पीपल लॉग्ड इन फ्रॉम अक्रॉस द सबकॉन्टिनेंट लिसनिंग टू यू. We've already spent more than 1 hour, but आपका टेक होम क्या रहेगा सबका, for everyone who is listening, in Hindi and English both, please?
Okay. Sir, very basic things. Exercise for 30 to 45 minutes daily in any form. Ideal would be if you can combine with a little bit of aerobic and strength. That means jahan running involved hai, plus thoda bahut muscle work involved hai, something like that. And even if you cannot do that, you just indulge in any activity which you like. Swimming karni hai, khelna hai, basketball khelni hai, tennis khelna hai, jog karni hai, walk, whatever it be, involve in any kind of exercise for at least 30 minutes a day. Go for basic healthy diet, home cooked diet. Avoid preservative in a diet. Saturated fat, keep it limited to 10%. And be on a healthy natural diet. Avoid supplements as long as possible, unless and until you want to compete at some level. And that will keep you going long. And avoid overdoing things. Don't go to gym that I have to lift 150 kg, I have to do 180 kg of squat today, or I have to do deadlift of 120 kgs. Don't have that kind of aim. Go exercise, work out, get yourself tired, enjoy yourself, and keep yourself fit. That will keep you free from injuries also. आपको injuries से भी free रखेगा वो.
इसके साथ आपको फिर से धन्यवाद करेंगे डॉक्टर सतबीर. इट्स बिन ग्रेट हैविंग यू, एंड ये जो आपका मैसेज आ रहा है ऑफ अ वेरी प्रोएक्टिव मैसेज एंड अ वेरी प्रैग्मेटिक मैसेज एज वेल, कि हम एक्सरसाइज करते रहें, फिजिकली फिट रहें, अपने आप को तंदुरुस्त रखें, यही मैसेज केके मेड टॉक्स सबको देना चाहता है. सो केके मेड टॉक्स आपकी सेवा में हाजिर होता है रोज 7 से 8 बजे. आई एम विद यू एवरी मंडे एंड थर्सडे. एंड जैसा कि आपने देखा, हम कोशिश करते हैं एक्सपर्ट्स लाने के लिए फील्ड में. डॉक्टर सतबीर सिंह जो हैं पूरी इंडिया में जाने हुए हैं. डॉक्टर कुलकर्णी साहब भी हैं आज हमारे साथ, एंड दे आर लाइक लीडर्स इन देयर फील्ड. सो डॉक्टर सतबीर, वंस अगेन थैंक यू, शुक्रिया, धन्यवाद, मेहरबानी.
Thank you so much, sir. Thank you for inviting us.
मेरा नेक्स्ट सेशन होगा थर्सडे को, और हमारे साथ होंगे डॉक्टर संदीप सूरी हिसार से, और हम बात करेंगे स्लीप मेडिसिन के बारे में, नींद के बारे में. डॉक्टर सतबीर ने भी आज टच किया इस पॉइंट को. यदि आप अच्छे से सोएंगे तो आपकी हेल्थ ठीक होगी अगले दिन सुबह. तो दैट्स व्हाट वी विल टॉक अबाउट ऑन थर्सडे. तब तक आप सबसे इजाजत लेते हैं. शुक्रिया वंस अगेन. जय हिंद.